We're up for the Partnership Working Award. We work in partnership to provide a scheme called Stepping Out Service for Dudley residents.
A lot of people don't tend to not think about their feet, but obviously it is, it's really important, especially as you get older. You need your feet to get around.
Age Concern in a number of areas across the country run nail cutting schemes.
It gives those people an alternative to private podiatry treatment.
It's a service that represents linking across from the NHS to the voluntary organisation, working together to improve the health economy of Dudley basically and its residents.
I've got an assistant and myself. We actually we've got the training in place by the podiatry, and the podiatrists also train our volunteers that we have to help us run the service.
It is a win-win situation for us. As a podiatry department, before Stepping Out service became available to us, it was quite difficult as a department to discharge patients who didn't fit the criteria for podiatry anymore, so we couldn't provide it to them on their needs base.
Yeah, it's a real partnership.
And we work well together.
We do.
It's a scheme whereby we monitor our patients with long-term conditions remotely at home using telemetry equipment.
It's early intervention, preventing patients coming into hospital.
The alarm system phone us on a daily basis. We're able to access the system, look at those patients' observations, and then we decide to act upon that.
Well, our patients are quite isolated often by their conditions, and the fact that we're all able to work together to support them to stay at home and to become able to manage their condition with confidence.
It's a cooperation between various branches of private sector and the council and primary and secondary care.
I think it's very special because I think in terms of everybody who we've described working together, it's had a positive impact on the patients out there.
Well, it's been a real challenge getting this sort of project up and running and working, but actually getting, sort of the teams and the clinicians to actually buy into this and actually to sort of dedicate the time to actually make the project work has been fantastic, and they are just a fantastic team of people.
I feel that the winners in this project is not us as a staff group, as clinicians, it's the patients, because the patients have got the care and support that they need when they need it.
Well, what we set it up to do was to stop the inappropriate referrals through to secondary care so that more patients could be managed in the community. We anticipated that it would that we'd reduce the referrals by 25%, but we've actually reduced them by 43%.
It's initiated elsewhere in the country, down in Taunton, where they've run it for 5 years successfully, but that of course has all been done locally by local GPs and local consultants. This is the first attempt, as far as we're aware, of it being done at a distance.
It's electronic remote triage, so it's not a face-to-face triage, it's just triaging the
Yeah, it's efficient use of resources, and what is particularly interesting is that the triaging is being done at a distance, so it's not particularly locally based, which is ideal for the NHS, because it means that people from all over the country can access one service, irrespective of location.
It's got huge advantages. For the patient, it means that they don't have to attend a hospital appointment because, as well as triaging the letter, the consultant gives advice to the GP on how they can manage that patient within primary care. So rather than having to go to a hospital appointment, the patient can just go to their doctor and be managed in primary care.
The great advantage for the GPs is that the turnaround time is usually within 24 hours.
That's 6 hours actually.
So 6 hours, I'm corrected. 24 hours being fair.
Yeah.
We set a criteria of 3 days, which means within 3 days GPs get an electronic reply back documenting investigations, plan of treatment, and the same information goes to the patient.
I think the best feeling is the fact that it's exceeding expectations.
It's great for patients, it's great for the GP community, it delivers financial efficiencies for the PCT locally, and also reduces waiting lists in our local hospital as well.